Well, good morning, everybody. This is Jim Hovland, your Edina Mayor. It is Wednesday, July 28th, 2021. Those 3 weeks since the 4th of July parade have really gone by in a hurry. This is your Mayor's Minute, and this week, I hate to be revisiting this topic with this kind of passion around the COVID, but we've got two really developing concerns or trends in our community that we need to talk about. And that's the spread of the Delta variant and vaccine hesitancy. Whether the hesitancy is based on philosophical attitude or health conditions, we don't know, but we've got to address that issue and talk about it straight up as a community. So we're seeing increases in COVID-19 cases, both across the United States and here in Edina, Bloomington, and Richfield, and they're all associated with the Delta variant. We're in a critical transition phase with COVID-19. Cases are relatively low, but we're heading toward a moderate amount of spread in our community. This means cases are expected to be widespread throughout our communities in a relatively short period of time. And the CDC defines this as 10 to 50 cases per 100,000 people over the last 7 days. We know we've all heard a lot about this, but it is true that the Delta variant spreads much faster than the Alpha variant that we experienced in the spring of 2021. In Minnesota, the Delta variant currently accounts for 75%. That's 75% of the new cases. There are ways to minimize your risk of being exposed to the Delta variant. The best thing you can do, of course, is to minimize your risk with Delta and other strains of COVID is to get vaccinated. All available COVID-19 vaccines have proven to be safe, effective, and free. I want to emphasize free for everyone. We expected to see a small number of breakthrough cases in those fully vaccinated, and we're seeing some of those because no vaccines are 100% effective. And we know that from getting a flu shot in the fall. It's going to minimize the impact that you have if you do get the flu, but it's not 100% certain you won't get the flu just because you had a flu shot. The same thing is true here. There is growing evidence that authorized vaccines provide similar levels of high protection seen in the clinical trials, and that's a really great thing to know. What's important to remember is that these cases have a significantly lower risk of being hospitalized with COVID-19. So when you get fully vaccinated, you might get sick, you might get a little bit sick, but the odds are you're not going to the hospital and you certainly aren't going to die. And that's the risk for the unvaccinated population. I think we've seen that nationwide, that the folks that are passing away are the ones that are unvaccinated for, I think, 97% of the cases. If you can't get vaccinated yet due to a medical condition, there's some things you can do to protect yourself, and we should talk about that because there are folks in our community that just haven't been able to get vaccinated even though they'd like to because of other conditions. Make sure you wear a mask in indoor spaces. That's not easy to go back to the masking, but I think that's something really important to be thinking about and doing to protect yourself and others. Inside your home, avoid any close contact with people that are sick. And then outside your home, just maintain that social distance we've all come to kind of accept of that 6 foot radius between yourself and people who don't live in your household. And then make sure that you avoid what they call now the 3 C's: closed spaces with poor ventilation, crowded places, and close contact with others. This public health guidance also applies to kids under 12 who cannot yet be vaccinated. Make sure that you avoid the 3 C's. Again, closed spaces with poor ventilation, crowded places, and close contact with others. This is Jim Hovland. I'm your Edina Mayor, and that's your Mayor's Minute for Wednesday, July 28th, 2021. Be safe. We're still going to get through this together, but let's all make sure that we get vaccinated to protect each other. Thank you.